Hi, I'm Dr. Jess Santucci, and thank you so much for taking the time to look at our website, and thank you for watching this video. So I thought the first thing I would talk about is why I do what I do, because I think why is the most important thing in any relationship. So when I'm doing business with somebody, I want to know why they do what they do. I want to know, do they have passion for it? Do they love it? Or are they just doing it for the money? A little over 23 years ago, I took over my practice. And about 4 years into it, I was pretty miserable. I didn't like what I was doing. I didn't like hurting people. I didn't like putting silver fillings in the back of people's mouths all day. Patients didn't like coming in, and I wasn't happy. Fortunately, about that time, I saw my mentor, Bill Dickerson, speak. And Bill was giving a talk in the city, in San Francisco. He had just started LVI a few years earlier, and Bill was talking about cosmetic dentistry. Cosmetic dentistry was just in its infancy, and he was talking about cosmetic dentistry, but he was really talking about enhancing people's self-esteem. He was talking about changing people's lives, and I just thought that was fantastic. So we went to LVI, and we learned how to do cosmetic dentistry, and we got really good at it. Now, cosmetic dentistry is basically porcelain veneers, and porcelain is essentially glass. So if you're going to put glass in somebody's mouth, you better know how their teeth come together, because if you don't, things are going to chip and break. And how your teeth come together, your bite in dentistry, that's called occlusion. And so I started taking occlusion courses at LVI, and it was vastly different from what I had learned in dental school. In fact, it was almost the complete opposite. And I was in class one day, and the instructor was talking about this occlusion, and he was talking about how you could treat people with chronic headaches and migraines with this occlusion. And that really made me sit up, because at the time my wife Maribel was suffering from migraines. When she got a migraine, she would have to go home. She would go into our bedroom, turn the lights out, put a bandana around her head, and crawl into bed and just cry herself to sleep. She thought she had a brain tumor. Her doctors didn't know what was causing it or what it was. The specialists didn't know what was causing it or what it was. And they were all just throwing pills at her. And she didn't like to take pills. The pills either didn't work or they made her feel a different kind of horrible. So we sat down and talked, and we agreed that I would start treating her. And 6 weeks into treatment, her migraine stopped, and once she was 6 months migraine free, I knew that this is what I wanted to do with my professional life. My wife Maribel has not had a migraine in 18 years, and in that time we have helped hundreds and hundreds of people with chronic headaches, migraines, neck pain, vertigo, tinnitus, shoulder pain, and a host of other symptoms. Every day I see my wife pain-free, I know I'm doing exactly what I should be doing. So again, thank you so much for taking the time to watch this video, and please click on part 2 so I can show you why you should come and see us. Thank you.